One of the things that has helped me feel that it's a safe space to walk into, especially when it comes to mental health professionals for me or anyone in my family, has been the ability of the provider to come out, meet you, introduce him or herself, and then walk you back to the office, because it could be a little intimidating when someone is sitting on a chair waiting for you to come in. So when the person, the professional comes out, greets you, shakes your hand, and you come in, they bring you into the space and they show you where you're going to be working on. Again, a comfortable place for me to sit and enough space so I can move around during the time that I am there. Also, lighting is very important. It's important for me too that there are blankets and pillows and a feeling that this is as close to sitting on my bed at home that I'm going to get, and that would relax me into feeling open and willing to share.
Well, I think in particular, since I work in the field, I think when I seek services, I'm looking for, like, you know, the moment I walk into an office, what's in the space? Is there anything that kind of resonates with me, like culturally or part of my identity? Am I thought about when this space is created in the first place? So is there something that, you know, even a picture on the wall that has some sort of theme of that's similar to my culture, being Mexican? And then everything from how I'm spoken to when I enter that space and in the office, and then what kind of thought has gone into like the intake process too.
I always try to find people that I can relate to culturally, I think, and also in terms of my gender. I identify as non-binary for the most part, so finding somebody that understands that from the get-go and not being gendered for me is a big thing.
The first thing that they do, instead of trying to rush me into, you know, their preconceived idea of what I might need, is, you know, they ask me about my own experiences. They ask me about, you know, things that I'm struggling with and how they can help.
I felt welcomed in mental health services and practices when I felt that it's included my cultural identity, my racial identity. I think when I see services that try to draw in practices that I feel like have an ancestral tie, you know, to me it feels like it's understanding that there's a history, and that there's a history that they're also trying to include. So I think whenever there's efforts to include cultural aspects, I think that's the times when I felt most welcomed.
I feel like for Latinx folks or for people of color to go into a space that is not just solely white people, you know, having people of color who, you know, can have a better understanding of the struggles that you go through in your day-to-day life, which affect your mental health, and being able to talk to them about that is something that you know, has been comforting for me and helps me to feel validated.
I started going to therapy for the first time this year in my life. You know, I think the biggest thing that at the very beginning, I remember just being like really nervous, you know, to try to like, you know, just feel comfortable and being able to like share and express myself. And like, you know, she was able to express to me that, like, you know, like her mother was from Guatemala, and like she was a first-generation immigrant. Her dad was from here in the United States, so she was mixed, and like, but she was she was just like, you know, like she had at least like the understanding of what like growing up in an immigrant family looked like. And it's like, you know, that made me feel comfortable, and then through just building with her in time and, you know, like making her laugh and just like seeing her authentic self made me feel comfortable through the process.
You know, I think of trust as it's you know, it's an agreement that I think takes time. I think it's also an agreement that everyone is participating in levels of vulnerability. So it's not someone who's just receiving someone's trust, but it's all parties who are being vulnerable, who are sharing, and that we know that it takes time. At least that's been the case for me. I feel like I need some time with someone. I need to know that we can all come in vulnerably. I can share, and that person's also going to share, and whatever agreements that we have are going to be honored.
Consistency, first of all, where it's like, it's just knowing that when like you say something, or you're getting like that feedback from the other person that they're active listening and that they're invested and that they care. A lot of people don't care about nothing other than themselves, and it's like, it takes a lot, I think, in this current context of like the world, to like care about others and like care about them like in a real way.
Like a sense of understanding of a person, not necessarily being able to fix your problems or anything, but feeling like somebody cares.
We know that like racial matching is great for like keeping people in therapy, but when it comes to outcome, there isn't like a ton of research showing that racial matching is needed for a better outcome. So I try to tell them that if it's someone who thinks like you, and maybe that's like anywhere from like how you process, or like your how you hold social justice values as important. So trying to find someone who kind of can match that perspective can be helpful in the work that you do for therapy.
Yo siento que si no convives con alguien, no conoces cómo piensa y siente, no puedes confiar en alguien. Porque yo puedo conocer a alguien y me pueden decir, mira, no puedes confiar en esa persona o algo. Pero mientras yo no la he tratado de convivir y caminar cierto tramo, yo no puedo decidir o darme el lujo de decir, oh, cierto, esta persona no. Es hasta que tú caminas y convives, entonces, y ya conoces cómo piensa y siente, entonces dices, sí puedo confiar en esta persona o no puedo confiar en esta persona. La disponibilidad del trabajador debe de estar desde que entramos ahí, la amabilidad. Y saben que los que vamos a llegar ahí somos gente con algún tipo de enfermedad.
I want to like go through this process with somebody that's just willing to be vulnerable as well, that just vulnerability of showing me like her process, like helps me just, understand that it's like, we're both working on stuff right now.
And knowing that that person, has some sort of professional background, is somebody who is, has some sort of credentials or has been in the community for a long time. And, the work that people do in the streets instead of just in the books also matter. So if somebody has been in the community doing work in a certain field and the community knows of them and knows them, I believe the community will trust their issues and be able to open up to them rather than somebody else that is new to the community, even if they have a title or a doctorate.
Good peer support in terms of mental health services. Thankfully for me, I did have friends that I turned to first before I turned to mental health sort of practitioners for help. And basically, I spoke to them, my friends, and talking about like things I was going through in life, and they were there to listen to me and to support me and to make suggestions about like the type of treatment that I might want to look into receiving, or hey, I know this agency, you might want to check them out. And then after I go in and I start receiving care, then that good peer support would be continuing to check up on me, make sure I'm doing okay. See if there's any additional ways that those people can help me, which is again something that I've been thankful enough to have received from my friends and my peers around me.
a supportive person would be someone who is a good listener, who knows when it's time to talk and when it's time to shut up. Somebody whose agenda when they're talking to you is not about proving their point or convincing you that their view is the right one, but that can witness where you're at, sit with you and hear what you have to say without needing to tell you how to do it better. Sometimes it's just that, just somebody who can listen without judgment and witness the experience you're having. And you wait if they want advice, if they want what you think, then that you can offer it. But one thing we don't get enough of is just being listened to, heard, truly, truly, truly having the opportunity to say whatever it is you have to say, the way you have to say it, without having anyone judge.
As a friend, I think I would provide tools for them. Maybe firstly, like I've been in crisis situations where people needed support at that moment and I'd have to take them to the hospital and everything. And I think that's a tool too, like despite, you know, the flaws in the medical system and the mental health system, like that's where I would basically take people first. And then moreover, if they wanted to find a therapist, then I would suggest tools like websites, because there are websites where you can specifically find someone that can meet your needs.
I have had the experience that no matter how turbulent my life is at the moment, if somebody reaches out to me with the same or different issues, it makes me feel better to step away from my own garbage and be there for somebody else. And sometimes people think, I don't want to burden so-and-so by telling them, but it's really, with the right person, it's really a gift that you're giving me by allowing me to clock out of my life for the time I'm with you and share with you and feel that I can do something, even if it's just listening.
Someone in my life that I trust is probably going to be my dad. He is very supportive of me. He always lets me know that no matter what I do, whether it be, you know, quote unquote, socially seen as something wrong or something good, he said he supports me and he will always be there for me no matter what my decisions are. So, for example, when I was going to school, he said, you know, no matter what degree you choose to pursue, I will be there, you know, and I will support you as long as I can financially and, you know, and emotionally.
I'm you know, making an effort to be, you know, very clear when I need somebody to come check in with me, and you know, I need that support. But I think for guys, because we tend to put it out there pretty subtly, and we can't miss those invitations to help a friend out.
Both as a receiver of services, as a client, and then as a professional and a deliverer of services, it's a collaborative process. And I always tell my clients, I may be bringing the expertise of mental health, but you are the expert on you. And so we have to work together to figure it out. I'm not going to be able to give you a one-size-fits-all, you know, cure. It's a process, and you have to be just as invested in the work as I am.
It's a two-way street. It's not just what I can do for you, but sometimes people don't realize how much they give back by allowing you into their lives, by allowing you into their problems, by allowing you into their needs. That is precious.
At least the way I like to do it is actually develop a genuine relationship. And so even if that takes a little bit of like chit-chatting of like who you are, where you're from, both sides, I think even as a therapist, I like to do a little bit of self-disclosure of like where I've come from, especially if I'm, you know, on campus working with a student who's first generation. I might share that too, just to be like, you know, I understand a little bit of what's going on and develop that trust and rapport.
Taking time to go into experiences, personal experiences from the professional's point of view, I think are appropriate as long as they are used to help you understand what you need to understand better, but not, we're not buddy buddies, but sometimes it allows the professional to be seen as human too. So with discretion and using it sparingly and appropriately, I have found it helpful the very, very few times when I have gotten a glimpse from my therapist's personal life, and I have found it helpful.
When I go in there to see my practitioner, it feels very relaxed and comfortable in the sense that it's more of a conversation and they're not, interrogating me. Obviously, they're asking questions that will pertain to my safety and making sure that I'm staying safe. But it kind of works as a conversation where, I do a lot of the talking, but, we reciprocate it and, exchange ideas back and forth. But the overarching theme is that, they've been very good at listening to me, very good at, validating what I believe to be, the reasons behind the struggles that I'm going through. And so I'm very thankful for that.
Just like sitting down and looking at somebody like a human being at their eye level without feeling like you're superior than them.
It's about patient understanding and about education, because I've learned a lot about just my own mental health, like through the conversations that I've had, because Lydia has educated me a lot on different things. And so, and just been supportive and just been honest and, I appreciate that. I think that's the thing when it's like, I think something might be a good idea and she's like, no. She gives me her no look and I'm like, okay, I feel you, Lydia, I got you. It's a bad idea.
Empowerment is going to look differently for different people depending on their conditions and situations. But for me, I personally experienced empowerment from my mental health provider in the sense that they have consistently helped me to keep a positive outlook on my life. Not in the sense of positive vibes only, don't be negative, or that sort of thing, because negative shit happens in life and we need to deal with it. But in the sense that they remind me that, as long as I keep moving forward, things aren't going to stay the same forever. And eventually, somehow, some way, things will start to look up, and it might not be the way that I perceived it to be or what I might have hoped for a long time ago, but they help me to keep that positive frame of mind, to keep moving forward.
And the most important thing to me and most powerful thing to me is just being able to be this is what therapy has provided me, is that internal little buffer of this is what unhealthiness looks like, but this is what you could do to be healthy. There's a difference between feeling something and then letting that feeling control you. And then ultimately being able to understand your own emotions is really powerful.
I think having physical words in a book empowers me. I don't know why. I think it's the act of physically writing something down and then expressing that to others, expressing my story.
One has to have the tools, understand the process and also the condition, the particular condition we may or may not have, in order to decide. Sometimes you need to take a break. Sometimes you need to reach out and tap into other resources. There have been times in my particular life that my church has been my therapy.
Even Lydia, she's given me different worksheets to take home and read and practice, different things to do when I'm feeling stressed or feeling different ways.
And using what works for you, because not all the suggestions somebody gives you is going to work. It might work for you, but it might not work for somebody else.
a lot of what we're trained to do comes from a very Western, like, individualistic perspective, and I think serving the Latinx community, I think it's really important to like unpack that, deconstruct it a little bit, and then put it back together with something that's more culturally congruent for like our people and our community. And so doing things that may seem like not the common practice for like the mainstream may be really important to do and do differently for the Latinx community. And so really thinking through and being thoughtful and mindful of how every practice we do maybe normally in the mainstream is impacting this community.
I think that a provider that is informed and culturally aware and understanding that not everybody is at the same place and has the same understanding, and to tread carefully with that, because our community is now moving into understanding the need for self-care, and sometimes mental health is part of that. But another piece that I think is very important is the ability to speak to a provider that understands your culture and your language.
La confianza de que y el entendimiento que la persona debe de entender esa acogida debe de ser el idioma y que conozca nuestra cultura para que haya una empatía y uno sienta que sí va a tener la confianza de poder abrirse y que lo van a poder entender.
When I see spaces that require an interpreter, so much is lost when you are having to speak through a third person and having to justify or explain things about your culture. That is different than when you are dealing with someone who is at least informed or familiar with your customs, your cultures, why some things are easier and some things are harder.
I wanted somebody to be able to understand what like I've gone through in my life, and like the circumstances that surround being like, you know, like basically an economic refugee in a country that is run by white supremacists.
Cultural awareness is definitely one piece of the puzzle in terms of, you know, understanding someone's heritage, or their background, where they come from, what makes them who they are. But it goes a lot deeper than that. I believe that in addition to cultural awareness, you also need a level of social and political awareness in terms of understanding these social structures and all the systematic types of oppression that exist in the world, you know, be it capitalism, white supremacy, ableism, patriarchy. As a mental health practitioner, it's important that you have an understanding of that history and of those political systems, so that you're able to then listen to your clients and understand how those types of systems might be affecting their lives. So that way you can work together to sort of hopefully find solutions and answers to the questions and the problems in their lives.